Now for here, we actually want to just refresh our memories on some key stops in blood formation pathways. Now this is the Granulocyte-Macrophage Colony-Stimulating Factor, the GM CSF, then the Granulocyte Colony-Stimulating Factor. That one is just the G-CSF. Okay, so you have an overview on it because we're about to start talking about some cancer drugs. I know in cancer there's like excess blood formation, so you want to actually tackle this so that you can follow up. Okay, anytime we are calling names like this, you still know what we are talking about. So what we have here is there are actually two key hematopoietic growth factors. Okay, they are very important in the formation of eosinophils, dendritic cells, macrophages. So they are actually key, like grandfathers of your immune system. Do you understand? So they are key parts of your immune system. So okay, they play distinct but overlapping roles in regulating white blood cells production. Coming. Now looking at them, trying to compare them on a table. For the granulocyte colony-stimulating factor, we said that primary target is neutrophil precursors. So stimulate production of neutrophils. So it makes it possible that you have a lot of neutrophils. That's just the colony stimulating factor. Then the granulocyte monocytes, macrophage rather, granulocyte-Macrophage colony stimulating factor. That one stimulate the production of granulocytes, macrophages, dendritic cells. So that one is a broader class. Okay. Now for clinical use for granulocyte colony stimulating factors, you have drugs that can be made to mimic them. Okay, so drugs like what? Filgrastim, pegfilgrastim. Of course, you are making those drugs because you want them to mimic these things so that you can have a lot of blood being produced. Okay, depending on the blood component, then also depending on the component of immune system that you want to boost. So if you have low neutrophil levels, you can now give it. It will now act as if it is a granulocyte colony stimulating factor, so that neutrophils production will shoot up. So it helps to mobilize what? Stem cells for bone marrow transplant. Then for the granulocyte macrophage colony stimulating factor, drugs like what? Sagramostim. They are used if there's like if the person wants to like recover, okay, start making blood again after a bone marrow transplant. So they enhance macrophage and dendritic cell function and all of that. Okay, so these are their adverse effects, that's their side effects when you use them for treatment. Okay, but of course they are used before you use them though. Just note that, just try to see if their importance will outweigh the issues. Okay, see if their importance will outweigh the side effects that they will actually bring up.